right, next up, everyone, is Bioxytran Inc. They are an OTCQB company trading under the ticker symbol BIXT. The company is a clinical stage biotech with two revolutionary platform technologies. They have an oral glycovirology drug that recently completed clinical trials and achieved 100% viral reduction in 7 days, a feat only accomplished by one other drug in the past decade. Their drug is a galectin inhibitor that neutralizes the COVID-19 virus and prevents it from entering cells. So today we'll be speaking with Mike Sheikh. Nice to see you again. And I know when we interviewed you last month, Mike, you announced your peer-reviewed journal article and you seemed pretty convinced it was going to be a major value inflection point. So what sort of traction have you been getting from either the investment community or the medical community?
So these medical journal articles that you see, they don't get very good view rates. No, there's not many people are looking at it. You know, we have a typical journal article that's out there. And you'll see on the right-hand side, they have this scoring system. And there's really nothing there. So these are the typical scores that you might get. You know, here, renewal of cancer immunotherapy. That's pretty exciting stuff. It's got a score of 15. Advanced glycation end products and psoriasis, 1. There's just not that much traction. So let's take a look at what happened with our peer-reviewed article. And you'll see here, here's our peer review, an oral galectin inhibitor in COVID-19, a phase 3 randomized controlled trial. 547. And you'll see there's like a little arrow there. That's where the score is. We're ranked 29 out of 3,500. We have news articles, blogs, tweets, Reddits. The scientific community basically comprehended these results. They understand what this means. They understand viral elimination of 100%. Now, the question that we want to look at here is on the right-hand side of this slide. It was released in November, and it has the same headline as the journal. Nothing changed. The investors have known about this all this time. Now it's peer-reviewed. It's absolutely critical for these scientists to want to disseminate the news, and they can't do it and won't do it without the peer review. And that's done. That's behind us. So that's the good news. Let's take a look at what happened in terms of Twitter activity. 1.7 million. So that is the audience that our journal article made it out to through just Twitter. This is why our score is so high. The scientific community really likes what we're doing and is really spreading the message. We're in the 99th percentile of all journal articles. That's our ranking over the past year. That's pretty amazing. Next thing, we do have a very avid influencer out there, Chris Turnbull, 317,000 page views when we took the screenshot. I just wanted to show you this as an example. Now, we also had solid news distribution. 22 news outlets pick us up. Let's look at the article traffic. So on the actual article itself, this is the chart that you're going to see. If that were a stock chart or volume chart, man, does that look good, right? On the right, that shows you what our stock chart looks like. It had this blip of life, and then it's been relatively flat. What you can conclude from this is that investor interest has not caught up to the scientific interest. The scientific interest is very, very high, and it's just a matter of time. Eventually, that's going to translate to investors, and here's why. As you can see here, Gilead was the last case study where you had 100% response rate in a viral disease. Their disease was hepatitis C. The stock, when they announced their journal article, it had an $80 billion valuation, and it went over $160 billion in a year and a half later. And I think it's important to let investors know that. The genie's out of the bottle on this. XBB is showing strong immune evasion to vaccines and Paxlovid. We had 100% viral elimination by day 7 in standard risk patients. It's a chewable, easy to take tablet. And we have a peer review article that arguably is reaching this viral status. Collaborators are approaching us and they want to utilize our platform technology. Scientists really understand the significance of what we have going on here. Now, in time, we think the masses are going to figure that out.